Thank you very much, Mr. Chair, and I want to thank you and the ranking member for your bipartisan work on this discussion draft of this bill, and I want to thank the witnesses for being here. I want to speak for a minute to the continuing work we're doing on the bill and note that as we continue our work together, it's really critical that we ensure that we are adequately prioritizing federal funding for states that have been hardest hit by the opioid crisis, a priority that has bipartisan support. I appreciate you recognizing that this is something that needs to be included. I look forward to partnering with the chair and ranking member and others on this. You know, I just did a ride-along in my home state with the Manchester, New Hampshire Police Department, and in my first hour and a half, we responded to 3 overdoses. So when we are hit hard right now with the fentanyl epidemic in particular that is so lethal, we really need to make sure that we're doing everything we can to help the hardest hit states and help the hardest hit states develop expertise. So I also appreciate that the draft legislation includes a number of other priorities I've championed, including the Comprehensive Opioid Recovery Centers Act, which I introduced with Senator Capito. There's a similar bipartisan bill in the House of Representatives as well. The bill would create a pilot program allowing HHS to award grants to expand existing centers to serve as comprehensive opioid recovery centers. These centers would provide a full range of treatment and recovery services to not only treat patients, but also to provide them with the wraparound services they need to move to successful and drug-free lives. The centers would also have outreach to community partners to provide information about the services available at the centers to help ensure that those seeking treatment know what their options are. The kind of wraparound support offered by Corks is critical for those in recovery and is especially needed in states hardest hit by the opioid epidemic. And I want to just add my to-do list to Senator Murphy's and others. I hope that the chair and ranking member will continue to work with me and others to make sure we're adequately prioritizing those hardest hit states in this provision concerning the Cork centers as well. I've heard from a number of providers and stakeholders in the Granite State in support of this legislation, and I hope we can get this bill passed. With that statement, now I do have actually a couple of questions. To Mr. Morrison, during our hearings on the opioid crisis, we heard from a stakeholder from New England who's utilizing a really unique model to increase access to medication-assisted treatment, a model I'm working on legislation to replicate on a national level. This model was actually developed with the help of our current Assistant Secretary for Mental Health and Substance Use, Dr. Eleanor McCants-Katz, when she was working in Rhode Island. Under this model, medical students are getting training in medical school on addiction issues and medication-assisted treatment. Once the students graduate, move on to their residencies, get licensed to practice, and get their DEA number, they can apply right away for a so-called data waiver to prescribe buprenorphine. They don't have to take an additional 8-hour course for it. They're just set to go. I really think what they're doing in Rhode Island is a great idea, so I'm working on a bill that I hope will be included in the bipartisan Opioid Crisis Response Act, what we're talking about today, to facilitate this program for other medical schools who want to do it. My legislation, the Enhancing Access to Addiction Treatment Act, will provide voluntary grants to support medical schools and residencies in developing their own programs to train students and establish a new pathway to let these trained practicing physicians apply right away to prescribe medication-assisted treatment, the same time they can start prescribing opioids. So, Mr. Morrison, what do you think about this idea? Will it help to increase patient access to medication-assisted treatment?
I think it will, and appreciate your leadership. I know our member, Becky Boss, when she presented testimony here, referred to that program as well, and she said it's found tremendous success to increase or decrease barriers and make it easier to get waived and actually dispensing and providing the care we need. And we know we need additional folks prescribing and increasing MAT. So look forward to working with you on it.
Well, thank you very much. And in my last half a minute, I just wanted to also talk with you, Mr. Morrison, about some really important work being done in schools relating to substance use prevention. One of the overdoses we responded to, we got there in Manchester, there was firefighters, EMTs, police, and DCYF, our Child Protection Services, because the ripple effect here is hitting everyone. In the Laconia School District in New Hampshire, they've been really hit hard. So I think there is more to do to encourage collaboration and cooperation. We have some examples, and I will follow up with you because I'm already over time on your thoughts on how we can better address efforts for school and treatment, behavioral health collaboration to really help our kids and our families who are traumatized and struggling with this. I'll follow up with you in writing. Thank you.